When we worry excessively, it becomes an anxiety. So intense worry gives birth to an anxiety. Welcome. Today we are going to be looking at anxiety per se. But before then, we are going to look at how worry gives rise to anxiety. Oftentimes, we use worry and anxiety interchangeably, but the truth remains they are not same. Worry is a component of anxiety, and there is a slight distinction between worry and anxiety. Let's look at some of them. Worry is physical, like worry is like in the head, it just involves your head, but anxiety involves every part of your body because it has to do with the cognitive, the physical, and the behavioral changes that goes with it. Worry is clearly defined. Like, I'm worried about getting to work late because I'm stuck in the traffic. But anxiety has a lot of verbal thoughts, have a lot of mental images. Worry gives birth to less emotional stress, but anxiety drains you seriously. Worry does not affect your personal functioning, but anxiety is disruptive. Now, what is anxiety? Anxiety could be a normal process. It could be just a normal response to threat. It's a complex response to real. The threat may be real, it may be past, it may just be something that you imagine. It's just this feeling of uneasiness that you have when that worry becomes intense, is excessive and persistent, about everyday situation or just anything. Oftentimes, it's just the way our brain reacts to stress and allow sorts of potential danger. So real or perceived danger, it causes an adrenaline rush. This adrenaline is a hormone, and what it does is it triggers the anxiety reaction into a process. We all know the fight or flight, just like you walk into a room and boom, there's a snake on your bed. Is it that or you take your leave? So, what could be the causes of anxiety problems? Everyone's experience of anxiety differs, so we cannot really come to a conclusion like these are the causes. But some of them are. It could be past or childhood experiences. It could be the present life conditions. It could be physical or mental health problems. It could be drugs and medications. It could be diet. It could be others. Yes, diets can cause anxiety. For past childhood experiences, we look at neglect when a child is being neglected, either from parents or whoever, losing a parent, having had to stay with someone who is not your family or is not your parent, physical or emotional abuse that lingers at a tender age or that you've experienced in life, being socially excluded. Another one could be present life conditions like financial difficulties. With the economic meltdown, a lot of persons are having money problems. So that could throw one into worrying persistently and intense worry. Housing problems. Maybe when one is homeless or whatever has taken over the home, being flawed, being was ejected from the home, earthquake, or any of the natural disasters. Another one is being faced with a problem at work. Probably there's a negative feedback or negative review from a client about your products. Like, it could be anything, problem with your boss, a mistake you made, or something that may cost you your job or you got fired. Pressure to meet a set target. Like there's this target you have set for yourself or probably for work. Loneliness. These are present life conditions that can throw one into an anxious state. Being abused, be it verbal, be it any sort of abuse, emotional abuse, any sort of abuse at all, loneliness, no one to talk to, no friend, oftentimes it throws one into depression, and that depression may lead to anxiety. Yes, anxiety leads to depression, but depression on the other hand leads to anxiety also. It could be physical or mental health problems. Yeah, it could be a negative report from a medical examination or results from an investigation that keeps you worried. You could be living with a serious or life-threatening medical condition that you're constantly worried about it. You don't know the prognosis is going to be the outcome of these things, and it throws you into an anxious state. Another one is depression. Anxiety leads to depression. Depression, on the other hand, can lead to anxiety symptoms, fear of the unknown. Fear of the unknown. This is where you have the perceived danger. You're just imagining, what if? The what ifs. What if this happens to me? What if that one happens? What if the other one? So, fear of the unknown, when it happens consistently and is persistent, it throws one into an anxious state. Drugs and medications. Some side effects of some drugs could lead to anxiety. I remember then when I was taking some drug, I noticed that if I take that drug, in fact, it worsens my symptoms, so I stopped. Some psychiatric medications. Then alcoholism. One that is addicted to alcohol, they might think that taking the alcohol is a way of getting relief from the anxiety symptoms, but no, it really causes anxiety. Diet. Sugary drinks increases anxiety. Desserts, like you have your cake, your pastries. Processed foods like chips, caffeine, coffee, and alcohol too. Not really that one is addicted to it. Maybe you just once in a while you take. It could throw one into an anxious state. So this is where we're going to stop for now.